end of September of last year, 2011.
Okay, and you had a scope and a mastectomy?
Yes.
Both sides or just medial, just
the
lateral?
medial
Just the medial,
side.
okay. And you're still getting pain around the kneecap with running, stairs, jogging, all that type of stuff?
Yeah.
No pain, just regular walking and normal daily life
No.
activities? Okay. Are you getting any swelling in your knee still?
No.
After activity? No, okay. Clicking, grinding, popping?
Oh yeah.
Okay. So we're going to look at your flexibility really quick. Hamstrings are very flexible, not a problem. Okay, I'm going to look at your knee flexion motion. Ouch.
Yes.
Okay, where do you feel it? Right on the kneecap?
Yep.
Okay, yeah, you definitely feel tight. You got some restrictions, probably due to your surgery and some tightness in your patellar tendon. I'm going to assume that your kneecap's not moving well because it feels locked up already. Okay. Just let your leg relax. Good. No pain when I extend it? A little bit?
A little.
Okay. Okay, let's check your hip motion. Good external rotation. Internal rotation is not bad, a little tight, but no pain with that.
No.
Okay. Okay, maybe sit up, let your legs hang over the edge. Do a couple muscle tests. Okay, I want you to hold your leg right about here. I put my hand on my knee. Don't let me push your leg down. Just fight, fight, fight. Good. This time keep your leg bent. Don't let me pull it straight. Pull, pull, pull it. Good. Okay, don't keep your toes up.
Sorry.
Hold there. Good. This time lift your hip off the table. Hold here. Hold. Come on. Hold. Pull up. Good. And relax. Not bad. I want you to roll your hips forward so you don't cheat. I want you to keep your leg right about here. Don't let your toes roll up. Okay. And just hold there. Hold. 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 Good. That's all right. It's actually not bad. Go ahead and switch sides. Check the bad leg.
Yeah.
Get your 2 cents. What's about to happen?
This is gonna be funny.
Okay. Get that hold here. Hold. Come on. Are you trying?
Yes.
Good. Hold. 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 All right. Problem number 1 has been found. Good. Okay. It's just to help me hang on to your kneecap. Good. So you're a little structured in superior glide and superior tilt. Again, that's probably due to all that some scar tissue, some adhesions in there, and it just hasn't been stretched properly since your surgery. Compare it with this side. Yeah, this side's nice and loosey-goosey the way we like it. So, like most patients after a scope, you got a little bit of scar tissue built up, you got some tightness in your patellar tendon, your quad. That's probably what's restricting your kneecap. A lot of people get pain down in here. The apex of your kneecap, your kneecap's kind of shaped like a guitar pick. You got the pointy end down here. Most studies show, they did actually really cool studies looking at pain centers. One of the highest centers of pain is actually the fat pad. So if this is restricted, it's keeping you in that inferior angle way down, shoving it into the fat pad and causing irritation. So most likely when you're doing your squats or running, jumping, that's just digging in there because it's not gliding properly. So that we can definitely free up. The other issue we'll look at when we do your functional test, you have a really, really weak glute med. Really, really weak glute med. Really, really weak glute med. What most of the new recent studies showing, this guy named Dr. Powers up at USC. Yeah, I went to but he's actually shown a lot of new research, a lot of the old biomechanical research looking at patellofemoral mechanics and people thinking that the kneecap used to move, you had to McConnell tape it to keep it in place. That's all been proven false. All that was done with open chain exercises. Most of the stuff we look at in terms of squats, lunges, running is more closed chain. And the structures are so strong between the quad, patellar tendon, its connection to the tibia. What actually happens is your tibia stays stable, your kneecap stays stable, and it's actually the femur that rotates. Most of the new dynamic MRI research shows that your femur, if it's not stable enough because of the hip, you have weak glute medius, weak core muscles, your femur actually internally rotates. So a lot of people make the mistake of saying the knee goes medially, which is technically true, that's the direction it goes, but it's not like you're getting like this massive valgus force and you're tearing your MCL. It's actually the femur is actually internally rotating and making the knee go towards the middle because you can't control it from your hip. So one of the big focuses of your rehab is going to be not only getting this loosened up, but really working on your hip, glute med, glute max, and core strength. And you should do awesome.
Sweet.
Cool.
Go.
And posture girl. Okay, so we went through a lot of testing today, as you can see, as some functional issues. The good thing is most of the dysfunction you have is all core and hips. Your quad muscles, your hamstring muscles, you're solid. You got some kneecap issues, which some therapy will fix. Like I said, doing the soft tissue patellar moves. But the big thing is fixing your mechanics. Your core muscles, you don't have good transverse abdominis activation. Your multifidus activation is absent. Your glute medians are pretty bad on both sides. But I think once you get more stable there, it's really going to translate into easier running, less pain, less problems. So a lot of things we talked about during your functional test we're going to do. You're going to do a lot of stretches, mainly for the calf muscle. We're going to really stretch out those, get a couple different stretches for those. We're going to work your core and your hips like no other. So a lot of transverse abdominis recruitment, a lot of multifidus recruitment, doing things like planks, side planks. We didn't test you, but I can already guess you're going to be awful. Add in the weak arms, side planks are going to be awesome for you. But also doing a lot of glute work, and also like the other thing we looked at before is looking at your land mechanics. We really got to train you to land properly, taking the weight through your ankles, through your toes, through your knees. That way you're not just shocking the knees and relying on your quads the whole time. And that's going to take a lot of pressure off that inferior pole of your kneecap. So a lot of the typical exercises, you know, doing things like isolation exercises like sideline hip abduction, like I said, doing core exercises, doing hip extension exercises, looking at proper recruitment patterns, making sure you're getting more glute activation versus just hamstring and extending your lower back. But once you get all that going, you should do a lot better, and it's not going to come quick. This is going to take some time. So,
All right.
sound good?
Yes, thank
All right.
you.